my name is Ashley Sikoski, and today I'm going to talk to you about post-traumatic stress disorder. Some events in one's life can be so memorable in so many ways, but there are other events that can be memorable in really terrifying and, for lack of better words, traumatic ways. They can have vivid memories and flashbacks of these events, and this can cause the post-traumatic stress disorder, better known as PTSD. According to the National Institute of Mental Health, PTSD is an anxiety disorder that is caused by shocking, scary, or dangerous life events that someone may experience. These experiences may have threatened, or the person may have taken it as threatening to their safety or their lives. And most people relate PTSD to one who has been in war, but that's not always the case. PTSD can also be caused by life events such as rape and domestic violence, and it can even be caused by someone being in a horrific car accident. There are many triggers other than just being at war. Natural disasters, such as dealing with something like a major hurricane in your area and losing everything that you have. Emergency responders, law enforcement, EMS, firefighters, they can suffer from PTSD because of the things that they deal with on a daily basis. They can have flashbacks and see all these horrific things that they deal with on a daily basis, and it can cause them to deal with PTSD. Another thing that can cause PTSD is if you suddenly lose someone that's close to you, whether it be a friend or a family member, anyone who is really close to you and that you love, that can trigger some really strong emotions and cause you to deal with traumatic episodes from there on out. The National Institute of Mental Health also says that to recognize someone, or maybe even yourself, having PTSD, some of the symptoms you should look for is re-experiencing symptoms. These can be nightmares, not necessarily nightmares, but other bad dreams. It can be flashbacks of whatever event may have caused the PTSD. You can experience avoidance symptoms, which means that you would avoid people, thoughts, places. You can avoid talking about things. Anything that reminds you of this event, you're going to avoid it, and that's a symptom of the PTSD as well. Other people may experience emotional or what they call arousal symptoms, which is lack of sleep, outbursts of anger, feeling like you're on edge, like you're just going to lose it and you just need to get away. And sometimes maybe that's the best thing that you need to do. But you can also have cognition and mood symptoms, which these may be you have negative thoughts about yourself, you have suicidal thoughts, you blame yourself, you feel guilty for what happened, and you feel hopeless and you're depressed and you don't want to do anything. All of these are symptoms of PTSD, and it does take medical diagnosis, but if you have any of these symptoms and you have been through a traumatic life event, maybe, or you know someone, there's ways to cope with it and there's ways to handle it, and that's the next thing I'm going to talk to you about is treatment. But before we talk about treatment, they're also, you have physical symptoms of the PTSD that go along with all these other symptoms that may include back pain. You may feel sick all the time. You may feel tired all the time. There's just general symptoms like, maybe I'm just sick. Maybe I have the flu, but if you're feeling all these other things, then it's most likely something more than just being sick. Knowing now the triggers and the causes and the symptoms, let's discuss some of the treatments. There's treatments through medication where a doctor is either going to give you one, or they're going to give you multiple medications to balance each other out and to balance your emotions and your feelings. There are several medications that are available to treat and cope with PTSD. They can use antidepressants. They can use blood pressure medicine to help regulate your blood pressure to not make you any more sick than what you may feel. They use tranquilizers, sometimes mood stabilizers, and neuroleptics. And you can either be on one of these or you can be on multiple ones to balance each other out, or just to have the right dosage of exactly what you need to make you be able to live your daily life without suffering. Another option aside from medication is forms of psychotherapy. And these options may include group therapy, family therapy, exposure therapy, where they're going to maybe reenact these events to help you better understand and deal with these things, because sometimes you might not clearly remember these events, so that they're going to give you the exposure therapy so that you can clearly remember it, clearly understand it, and that way you're going to better know how to deal with it. You can also do cognitive behavioral therapy and psychodynamic therapy. So in conclusion, I hope the information that I've shared with you today will help either maybe you or someone else around you know how to recognize the signs and symptoms of PTSD and know that you're not alone and that there is help out there, and it's not something that you have to deal with without talking about it.